Michelle Graves, your host on The Power of Money, and I'm honored to have you as a part of my world in this coming segment. With The Power of Money, as you know, we are interested in three things. First, that you get the necessary education so that you and your family will have the information to do well in these difficult times. The second thing I'm interested in is for you to be empowered to prosper. I want only the best for you, but you can't get that if you don't have the education and then the drive to make it happen. And the final thing, and perhaps the most important thing, is that you be energized. Because life is more than a journey. Life is about living. And so I want you to learn these things and to be empowered and encouraged and energized. I'm Michelle Graves. Now here we go. And here we go, and I am your host, Michelle Graves, affectionately known for the last 40 years as the Money Lady, and your host on The Power of Money, which has been broadcasting through DATV, based in Dayton, Ohio, for the last 9 years. And I'm honored and delighted to have them on board with me, top flight people, knowledgeable, skilled, and they just take this show to another level. But as always, and you know my commitment to empowering you through information, resources, and knowledge, I'm delighted to be able to talk for the next hour. That's correct. You're going to have to sit still for an hour, but it's good stuff. It's stuff that's going to help you, whether you're young or old, not color-bound. But my guest for the next hour is Dr. Curtis Weaver, who has been a nationally recognized Medicare consultant for 20 years and counting. And I had him on my show 3 years ago. If you want to go back and find him on YouTube, you will. And I interviewed him then on Medicare. And I'm interviewing him today. Was able to snag him because he's not based in our neck of the woods, but he is here to talk about the upcoming Medicare season. It's fast approaching, and for those of you that are turning 65, we call them T65s in our industry, you want to be tuned. And for those of you who are older but want to get a better understanding besides listening to those crazy TV ads, you're talking to the best. I wouldn't have him on otherwise. So without a lot of clutter, I just want to get right to it and encourage all of you, if you have questions about Medicare that you feel comfortable, he's going to give his phone number. And I'm going to say to you that I would be so appreciative of you taking advantage of that resource, because he doesn't do that, and for questions that did not get answered on the show. With the hour that we have, we're going to have to cover some of the broad questions that you might have to enable you to kind of look through this and see what you're going to do. It is complicated, okay? I'm so serious. It's complicated. I'm over 65, and I still run into snags, and I still call him to get clarification. So, introduce yourself to our audience, and let's get going.
Thank you, Michelle. I don't know where to start. I've been in this industry some 20 years doing financial advisement, financial services, as well as Medicare. One of the reasons why I got into, I think this career actually chose me. When I first was introduced to prescription drugs and Medicare supplements, I really didn't understand it. You know, I was dealing with retirees. I was actually working with a company, and that was my specialty, retirement planning. But when prescription drugs and Medicare supplements came about, I said, no, I really wasn't thinking about it until another company came. And I had to look at it from a perspective of it all matters. It all matters to your bottom line of when you retire, things change. When you retire, you become, you're on a fixed income. So being on a fixed income, you have to look at it from a perspective of outgo. The outgo of income, whether it be my housing, whether it be my bills, whether it be my food. All these things are factors. Healthcare is the most, as we get older, the largest expense that we would actually have to pay. So
Is that so?
it is indeed. What changes is when you were in your 20s and 30s, you had extra money and you could go and buy homes and cars and you had your family. But when you get older, the outgo of your income is going towards maintenance of your health and maintaining your health. So what you have to look at is, what is it going to cost if I were to get sick? How would it affect me? Where would the money come from? Who's going to take care of me? And I still have to run my same pattern of life of the daily routine of grocery shopping, paying bills, taking care of loved ones. So it all matters and it all costs.
That is humbling to hear that you work your entire life. You take care of your children, you take care of grandchildren for many seniors, and all they want is peace of mind and not to have to worry about everything. And so on top of retiring and getting older, now they've got to deal with the reality of aging.
Yes.
And sickness.
Yes.
And body parts that can't be replaced.
Right.
Like a car.
Yes. Yes. So when you look at the outgo, we're talking about prescription drugs, we're talking about health care, we're talking about hospitalization. All of these things we have to kind of look at. And like I said, we also have to pay attention to the regular outgo of expenses that we have to pay.
So I just heard an interesting statistic that for the average senior, $330,000.
That's correct.
For health care.
Yes.
Expenses.
Yes.
Whoo-wee.
That's the average cost.
The average cost.
Yes.
What is that? Is that for what, hospitalization?
Well, when we get, or when something happens to you, we never know how long it's going to take for you to recover. And we can't put a dollar amount to specific or an actual amount or an account to how much is it going to cost per day in the hospital. How much is it going to cost per day for living expenses? How much is it going to cost and how long? So all these things start to tally, and you look at it from a perspective of, I may run out of money. And if I run out of money, what's my result? Or what's my end game? So when you start to get older and when you start to age, we call it the cost of aging, these are factors that we have to pay attention to. And we all individually have to go through this process, whether for ourselves or for our parents, or even sometimes for our kids, because kids get into accidents. We have to be put into facilities, long-term care facilities for young and old. So we have to we have to protect ourselves, and we protect ourselves with insurance.
Okay.
So that's one of the things that we want to talk about. Medicare, I'm here to talk about Medicare and what Medicare does and what your options are for the upcoming year, because things change annually, and we have to look at it from a perspective of being current and understanding what our choices are.
So my question to you, and I'm just going to, for the benefit of those of you that are not familiar with Medicare, this is going to be for you. Medicare is a federal health care plan for people that are 65 years of age and older. It also includes people that have been on Social Security disability for more than 2 years. That could be 2 years and 1 month. It also includes people that have Lou Gehrig's disease, and it also includes people that have end-stage renal disease. Those are very powerful pieces for a lot of people. But this is a federal program. And as such, and enrollment in this program is not optional. at 65, you're in. You have to make those moves. And so I brought him on because so many people are completely confused and don't know how they're going to do this and what they should be doing. And so he's kind of here to open it up and to share with all of my viewers who are watching so that you can be better prepared.
Yes.
You may not be 65, but you are heading in that direction. Just keep living. For younger people, it's very important because many times your parents are not on top of things, and the burden of responsibility for information will fall on you. So you need to be aware as well. So just moving ahead, why is Medicare so complicated?
Because it has a lot of moving parts, and everyone's situation is so different. We have two different parts of Medicare. We have Part A for hospitalization and Part B for medical. Well, to you, what does that mean?
Yeah.
Well, we have to talk about that is original Medicare. This is the baseline of Medicare. Your hospitalization, the Part A, let's start there. Your Part A comes from the years of us working when they were taking money out of our Social Security check. That part was actually set aside for the Part A, which is hospitalization. Hospitalization meaning the hospital, skilled nursing care, rehab center. If we ever have to go into that situation, that part is taken care of from our years of working.
Okay.
The Part B.
Now, what happens if you didn't work enough years to have that automatically paid for?
Well, in most cases, if you haven't worked enough quarters, you probably would have to pay for that part of Part A.
Okay.
So that would be a cost. So when we look at, let's make the assumption that everyone's kind of made that or put in 40 hours over the course of their life. Okay. The Part A covers that. The Part B comes from our Social Security, meaning that that other part that we would actually have paid in terms of the government set aside for us, that part would actually cover our doctors and physicians. So to be a part of original Medicare, Part A for hospitalization, Part B for medical, doctors, that comes out of our Social Security check every month. And it really depends, the cost varies based on what they call your annual gross income. How much were you averaging per year? On some cases, per year, what you actually make per year. So some people would pay more if they earned more. Some people would pay less on average for that amount. So coming up, we have, I think, an increase. It's up to, I think, $177 per month coming out of your Social Security.
And that's the minimum you can expect to pay for the Part B coming out of your Social Security.
It is the minimum, but in certain situations, some people may not even pay that.
Oh, wow.
Meaning that we have Medicare plans that actually pay your Part B premium. So we'll talk about that when we start talking about people with conditions or people, and that can be, diabetes or congestive heart failure and certain health conditions. Mm-hmm. The other part of that is for folks whose income may be below the poverty level or the government standard. They get what they call LIS, a low income subsidy, or additional help. And in getting that additional help, those individuals won't pay or won't have to pay things like the Part B if they were to pick a plan, and we'll talk about the Medicare type of plans.
Okay.
In many cases, some people will pay more than others, but on average, it's going to be the same.
So if a woman never paid in, but her husband did, is she okay?
Well, in many cases, if he has worked those 40 hours, she, being his wife, can apply for those Social Security benefits on this Part
Okay,
A.
that's comforting because a lot of women did not work in that generation. Older women, the women today that are older, their
Right.
husbands were the primary bread earners,
Right.
and so they didn't. And that is a concern.
Yes.
Is she going to be covered?
Yes, she can. She can
Okay.
apply for those benefits.
Okay, not under him, but separately.
Well,
Correct.
actually, it won't affect him one way or another.
Really?
Right. So
Okay.
it's not coming away or taken away from his income.
Okay, that is very, very good to know. So there is original Medicare that is Part A and Part B,
Right.
and that's the one that was originally
Yeah.
out here.
Yes. And there are actually three parts or three ways that you can actually receive your Medicare benefits.
Okay,
You can have your original Medicare, Part A and Part B. And also, Medicare requires that you get a drug plan.
okay,
This is your number one way. A Part A, Part B, and a drug
and
plan.
a drug plan, and you have to have the drug plan.
Yes, you have to have a drug plan, and when you become Medicare eligible, there's a certain amount of time that they require that you do receive or start to apply for the drug plan.
Okay.
So there's a window, and once that window closes, if you go beyond that, you assess the penalty. So
There's a penalty for you not doing it.
right,
Do people know this?
most people don't.
Oh my God. Is this an arbitrary penalty, or is this just based on your being non-compliant?
Pretty much, this penalty is assessed and it's paid for the life of your life of getting prescription drugs or getting a Medicare Advantage plan. And we'll talk about the Medicare Advantage plan.
So just for clarity, when you turn 65
Yes,
and you go and enroll under the original plan,
yes,
A and B, and because from my understanding, Social Security does not tell you you've got to do prescription.
right.
So how do you know this?
Well, they give you a booklet called Medicare and You.
Okay,
And
which
this-
nobody reads because it's too complicated.
Yes, it is. So with that, Part A, Part B, and Part D for drugs, medications, you have to have that. That's your number one way. The second way is what they call Medicare, or let me put it this way. You can have original Medicare, Part A, Part B,
And
and a supplement.
Okay.
Okay. Now with the supplement, basically it supplements what Medicare doesn't pay.
Okay.
Okay. And you also have to have a drug plan.
So now you have
Part A,
Part A, Part B,
a supplement,
and
a drug plan.
plan. So there's 4 things you have to have,
Right.
and none of them are free.
Well, no. The supplements, in many cases, this is the most expensive way that you would actually receive your Medicare. Meaning that supplement, depending on which plan that you pick, from A to J, many of those have different coverages that actually cover. So, for example, if you had no plan that didn't pay for skilled nursing,
Okay.
you can actually opt, meaning that from A through N, they have different select plans that you can pick. All of them have a different cost. So let's take on average, in many cases in the past, individuals would get an F plan. The F plan would cover everything, the deductible. In many cases, you only pay for the monthly premium.
Okay.
Okay, so we're looking at our cost for our Part B. We're looking at our cost for our premium for our monthly, which is ranging from anywhere from $150 per
month?
per month. And then you're also looking at the drug cost, which is on average costing you about $40 a month.
Whoa. And this is mandatory.
Well, this is an option.
Okay.
Okay, so original Medicare, going back, number one way, Part A, Part B, and a drug plan.
Okay.
Second way, original Medicare, and a Medicare supplement and a drug plan. And the third way is what they call Medicare Advantage. Now, Medicare Advantage hadn't been around that long, but basically it came about with the remodernization of Medicare, meaning that when they were looking at structuring, they realized that if they didn't make a choice or the government have an option of putting the plans in place, that we bankrupt the Medicare system. So Medicare decided that they would actually contract with private insurance companies. So the Aetnas and the Cignas and the WellCares and the United, all these companies actually are paid by the government to manage your health care. Meaning that you're still in Medicare, you just get it through a private insurance carrier.
And what are the benefits?
Well, the benefits meaning that in most cases you don't have the deductible that you typically would pay or have to pay under having original Medicare or a supplement. Also, your drug plan is included. It also covers things like dental and vision, hearing tests, and gives you, fitness and the whole litany of benefits. So what happens is your health care plan is more rounded and it's something that you can manage versus you having to spend large sums of money of a supplement and a drug plan every month.
Okay.
So you factor that in between a husband and a wife, that cost can get kind of out of control.
It definitely can get out of control.
Yes.
But the data says that while the third option is clearly on the rise, many people are still up under that original Medicare.
Yes, they are.
And why? Because they don't know any different.
Right. No one's explained it to them, and it's different simply because they don't know that they have other options.
Right, okay. Because I'm doing the math, Dr. Weaver, it suggests that you're going to wind up paying a lot of money.
You will.
Under your original plan.
You will. And you run into a situation where Medicare by itself doesn't have a cap, meaning that your spending can run into the tens of thousands and even millions of dollars when you start to look at out-of-pocket expenses that you would have to pay
under the original
Medicare by itself.
Well, I just remember maybe a year or so ago, there was a lady that had cancer.
Yes.
And she was under original Medicare.
Yes.
And her bill was in excess of $1 million.
Yes.
How does that happen with something like that?
Well, the difference between original Medicare and Medicare Part C, which is what Medicare Advantage is, basically with original Medicare Part C, the plans are controlled, meaning that there's a stop loss, meaning that worst case scenario, if my cost gets to a certain level, the plan says enough, we'll carry the rest. So 100% the plan is actually paying versus you having open in original Medicare and the cost continually going up and up and up, and you can bankrupt yourself, with $1 million of you can run up a good cost or bill with
yeah.
that.
Well, she was very well, she's elderly, and she just said, well, if I don't pay the bill, I just don't pay the bill. And I said to her, but can you look at this differently in terms of being able to have the ability to have a plan that would cap the amount you'd have to pay?
Right.
In many cases, it's very nominal.
Yes, it is. And in many cases, it's a zero premium.
Right.
So on average, you wouldn't have a monthly premium that you would have to pay. In many cases, you wouldn't have a deductible that you'd have to reach.
Under the original plan?
Well, under Medicare Advantage.
Okay.
So under Medicare Advantage, this gives you an opportunity to reduce your costs and to cap your losses. So, and it actually gives you the full range of benefits, all that are under Medicare. So doctor's visits, hospital stays, exams, lab work, preventive care, skilled nursing, durable medical equipment, prescription, all these things are wrapped into one package so that you don't have to worry about, in many cases, it's a fixed cost, so you know how much you're spending per month. And if that cost ever reaches that limit for your medical, the plan says enough, you don't pay any more co-pays.
People, I'm telling you, people don't know that.
Yeah.
Now, under the original Medicare plan, the one that was birthed, is dental and vision and those kinds of things covered under the original plan?
They are not, and that's one of the things that you have to take on. So you would have to go out and get you a standalone dental plan, a standalone vision plan, a prescription drug plan. So you're looking at a number of different premiums, at least 4 premiums, and you hadn't even been to the doctor yet. Mm-hmm. So when you start to look at cost, Medicare supplements are going to cost you more than they're not going to cost you as much as original Medicare by itself, but actually they're going to cost you. And that's probably the most expensive way. But having original Medicare by itself, that's almost unthinkable because you're putting yourself in a position that really leaves everything open-ended to
But
cost.
I think, Dr. Weaver, the reason that people stay put is because of lack of knowledge.
Right.
They don't know what you know and the little bit I know, and then they watch these television commercials
Yes.
all day and all night.
Yes.
And with star power, Joe Namath, Jimmy,
Yes.
all these personalities on a personal business decision.
Yes.
And because they don't know, they get tied into situations that are not necessarily good for them.
They do.
So what happens when they enroll on TV and it doesn't perform?
Yes.
Do they have options at that point?
Well, it depends because there are certain times that you can enroll in these plans, the Medicare Advantage plans or original Medicare. So someone that's coming out of the workplace has a window of 8 months to
After
enroll.
they come out the workplace, okay.
Yes, after they've come out the workplace to enroll in a plan because they've left their employer, they have to pick up their life insurance, they have to pick up their qualified money. So these are things that they have to kind of take on themselves. What this simply means is that if you don't enroll in one of these plans, you'll be penalized. And that penalty pretty much lasts a life as long as you have a drug plan. And when you decide to get a plan, that penalty is assessed. The option for you is to look at Medicare Advantage because in some cases, some people may be disabled. And being disabled, meaning that you don't have income coming in.
Okay.
Which means that you may qualify for extra help from the state. And when you get extra help coming from the state, that means that now you're dual eligible, having Medicare and Medicaid. So having Medicare and Medicaid, that puts you in a whole nother kind of category.
So let me stop you here because you're using some terms that people may not be familiar with or comfortable with. So if a person is disabled
Yes.
and doesn't have a lot of resources financially, including income,
Yes.
they may be able to make application with their state
Yes.
through their Job and Family Services in some states and others, the Aging Council, but they can be qualified or at least go through the process of getting qualified
Yes.
to become eligible for Medicaid.
Yes.
And the reason for this, as I understand you, is they can get coverage from Medicare
Yes.
and Medicaid.
Yes. They can have the same benefits, pretty much the same benefits of a Medicare Advantage plan as well as original Medicare. And in many cases, depending on their levels, they may be paying $0 for their medical, as well as their prescriptions may be minimum. So you can look at someone who has disability, who has qualified for Medicaid, they could go into a Medicare Advantage plan. We call it a dual eligible plan, meaning that they're dual eligible, meaning they have Medicare and they have Medicaid, and it has a drug plan and all the benefits of a Medicare Advantage plan.
So they get everything.
Yes.
Everything.
everything.
And pay very little,
Very little, if anything.
if anything,
Yes,
because their income is low
yes,
and they're eligible for Medicaid
yes,
and also Medicare.
yes. And
That's amazing.
it is. It is
Who knows this?
very few people. But at the same time, there are many companies, as you were talking about, the Jimmy's and the Joe Namath commercials. And I don't speak against them. I just know that you're not going to get that level of in-depth information simply because the questioning, the folks really don't know what they're eligible for. So you're going into this situation and you're trying to get on a plan, but you really don't know. Some people may have conditions, like I said, a chronic condition,
Yeah.
Congestive heart failure or diabetes or what have you. Those conditions qualify you for another type of Medicare Advantage plan, which we call CSNP or Chronic Special Needs Programs. Chronic Special Needs Program basically gives you access to the same benefits of a Medicare Advantage plan, and those members really pay little to nothing at all.
And why is this so? Because the government determines that these people need special management or something?
Yes, you're in a special class, in a protective class when you become Medicare eligible. So with this those individuals having chronic conditions or dual eligibility, their income is non-existent. So now they're getting help from federal as well as state, and there are programs out there for these people.
That is, so viewers, let me posit a couple of things to you that are important. The first thing is that if you are low income or if you have conditions that prevent you from earning, you need to look into Medicaid to get qualification. And again, call your agency in Cincinnati and Dayton and other areas. It's usually under the Job and Family Services, but you can also Google under the state you're in and under Medicaid to find out where you need to go. This is so very, very important. And I cannot overemphasize that this is a benefit that is specially for people that are eligible. You pay virtually nothing. I think the prescriptions are $1, free hospitalization, free doctor visits, free specialists. I mean, the red carpet is really laid out for people that need the help financially. And you should take advantage of it. Even if you think you may not be eligible, if you are, again, in a income situation, it doesn't hurt, it doesn't hurt to go on and find out if you are eligible. Am I right?
You're right, and we're not going to say that it's free.
Well, okay, I won't say, because
but it's little to nothing.
Little to $1 to me for medications today is akin to free. But some of their benefits literally are free, though. The dental.
In many cases, the dental plans are in the Medicare Advantage plans, meaning that dental and vision, silver sneaker programs, fitness programs, a number of programs to help you with utilities, companion animals, electronic animals now.
Yeah.
So they have all kind of things that are available to members or Medicare eligible members that will enhance your life and better your life and help you live longer.
So let me ask you this. If I'm telling them not to do television, which I'm just really not happy about that, and that's on you not to speak ill of them, but I'm Michelle Graves, and I am saying I can't stand those commercials, and they're all day and all night, and you can't control it. And I get a lot of people complaining, and I share with them, there's no point in you getting angry. America is about business,
Yes.
and television is about advertising.
Yes.
And as long as they can pay the bill, they are not necessarily ethically bound to make sure that you're okay.
Right.
They have a product to push, but where can a person find a qualified agent to assist them?
Well, in many cases, each company that's in the metro area, they have agents that are available. I would start there with the local office, because these individuals are trained and they understand Medicare, they understand your situation better, as well as the area. And because of these individuals, start with the companies that are locally. You know, they're
So
good.
what if you don't know who's local?
Well, when you go and you receive your Medicare new book,
Okay.
you can look in the back of that book, and it'll tell you all the companies that are in your area specifically.
Oh, okay.
So
So you go to the back of the book,
Yes,
and they send that book to everybody.
everyone who's Medicare eligible receives that
That book.
Yes,
And just go to the back,
Yes.
and it gives a list of carriers, and you can start going there. Are there any other recommendations that you can make
Yep.
if they don't want to go to the book, or they go to the book and they don't understand the book? Are there any kind of presentations or?
yes. There are seminars that are going on in your city, and that's one of the things that to go in information sessions. So there are educational seminars that will be coming out, and we're coming up on the time starting September, October. You're going to start to see and hear more and more Medicare commercials, as well as seeing brands of United and WellCare and Cigna and Anthem and Aetna. These are companies that you're familiar with, as well as the newer companies, Devoted and Molina and Medigold. And so there are many companies out here, and basically they all do the same thing. They basically have to kind of tailor to your need, though. So if you have a question, those are the guys. We're going to be doing seminars here locally soon, but I wanted to kind of express that plug into those information centers.
Okay.
Because that's where you would actually get a representative that's local. That person can be your person and go to, and they're more astute in understanding your situation in that area and the plans that are best fitted for you.
So my question again becomes, you call these individual carriers, and they have an agent that talks to you who's representing that particular carrier.
Right.
How can you know what's best for you if you're limited to one carrier?
Well, there's a two-way prong to that. You can deal with an agent who represents the company, or you can deal with a broker that represents them all.
Okay.
So the broker is going to give you a different kind of comparison versus the star rating, or for example, the star ratings, the cost of what things cost. You can actually put them up side by side, so you can actually look at the different plans. So to have someone kind of explain that to you and go through that with you, it helps you kind of better understand and get a feel for what these plans do.
Well, I will tell you, on my first out with Medicare, I was completely overwhelmed and confused.
Yes.
No, really, I was. At that time, there was no one doing seminars that you could go to learn, and so I took the recommendations of another agent and just enrolled
Yes.
in a plan that's turned out to be okay. I'm going to make some changes this time around when open enrollment takes place, which, by the way, listeners, viewers, you have the right to do that. Okay, in October, when this thing kicks off, If you're not happy with your current provider, you can switch. But whatever you do, make sure in doing the switch that they cover your doctors, your medicines, things that you may not think about in your anxiety to move. You want to make sure that all your ducks are in a row and that you have the information in front of you to share with them so that the optimal decision can be made for you. People can't figure your world out if you won't share it. So that's my 2 cents. I'm actually in the midst of learning so much more. I really, really do mean it. And because Medicare is complicated.
It is very complicated.
Jeez.
Don't
So
do it
explain
by
to me
yourself.
about this certification thing, because people do need to know that there is a process, that people can't just start telling you what to do and how to go. Can you talk about that for a minute?
Sure.
The certification.
Yeah, each year the Medicare, the American health insurance providers, they have a test that really qualifies Medicare agents. And if you're going to offer Medicare to members, you have to go through this certification. Now, it's pretty extensive in that you deal with all aspects, prescription drugs, Medicare Advantage, the different types of plans, HMO, PPO, private fee-for-service, HMO, POS, the different types of what can be said and what can't be said. So it's a pretty rigorous test that you have to take every year.
And that's nationally?
That's nationally.
Okay.
So in order to offer these plans, each individual has to go through these tests, and you have to score pretty high, no less than 90 on these tests. So that's missing 3 to 4 questions out of a litany of questions. So when you take this test, this qualifies you now to go into each and every carrier that you're going to be representing,
Okay.
whether it be Aetna, or Cigna, or WellCare, United. You have to take their certification. So you've taken the AHIP, and then you've taken the certification for the company, and that way you actually have the verse, and then you have what they call another status that's ready to sell or offer the product. So that's the standard for Medicare agents or Medicare. So rather than have someone on the phone who may or may not even have to go through that AHIP test, they're basically just giving you information on the different plans that are in the area. You have somebody that's knowledgeable and has to be compliant with that information. So when we talk about dealing with government insurance, this is pretty much the standard every year for agents.
And they have to do it every year?
Every year to certify.
Well, that should be a comfort when you say that if you're dealing with someone who is authorized by these carriers, you can feel fairly comfortable.
Yes.
And knowing that they are trained to look at your situation
Yes.
objectively.
Yes.
That's important. So tell me, what are you doing during this season?
Well, we're doing a lot of things. We're going to be putting on some seminars, Medicare 101, because it's very important that people understand how Medicare works and why things are in place and how to make things work for you. So these seminars are going to be at a number of facilities, and we'll keep you posted on that. But that's what we're going to be doing this season.
Okay,
Yep.
so you're going to be boots on the ground
Oh yeah,
with
definitely.
the people. What have been some of the more challenging situations you've run into with Medicare as a consultant?
I think after a certain amount of time, you see so many people from so many different with so many different health situations, trying to help them kind of navigate through and understand, dealing with these various insurance companies, because they all have their own internal systems. So you have to kind of show your member and help your member kind of navigate through and show them where to go. Things have changed over the years. There was at one time more of a I think a more caring kind of spirit of trying to make sure people got the information. I think with what we've had going on, people have been overwhelmed with COVID and everything else. It's caused a lot of people to kind of leave the industry. And in doing so, they left a lot of holes of trying to get places filled. So just that reassessing of, rebounding from COVID, where we used to do seminars, we had to kind of pull back on that, had to do more virtual. Some people have tech savviness, some don't. So
Yeah.
we have to go back to kind of explaining. Trying to explain these plans over the phone is like building a house over the phone.
Oh, I marvel
Yeah.
at the ability to get anything done correctly with people you don't even know.
Right. Yeah.
I
That's
guess I'm a
challenge.
touch feel person. I need to know that I can reach you. I don't need to talk to a telephone person or a computer. That's a little bit challenging.
It is. It is. So the biggest challenge is now with the COVID kind of being at bay, but I think it's coming back. Having those options of how do you want to be touched, whether you want to do a virtual or whether you want to do a over the phone or whether you want to go through your phone or
Or face to face.
face to face. Face to face works best for me simply because you can understand and you can ask the questions that are near and you can have the information right in front of you.
Well, I think one of the real challenges today is that we have 350 million adults in America,
Yeah.
of which a large number are moving quickly into the 65-year-old category.
Yes.
And I remain deeply concerned about the quality of medical care with all of these baby boomers, of which I'm one, are going into this industry, and with lack of information, we're doing the best we can, but our personal health is private and is a challenge.
Yes.
And I know for myself, and I'm sure I speak for others, doctors are retiring. They're out. And I'm not mad at them, because if I had to do what they had to do every day, I would be running for the door.
Yes.
I would not be pulling this thing along, but it does kind of leave us hanging because we really don't know who we can look to. Is holistic medicine a covered benefit with Medicare?
Well, it's soon becoming in some of the plans. They have a network of doctors that are holistic doctors.
Really?
Yes.
That is very. What about podiatrists?
Yeah.
Are they going to be dealing with podiatrists?
Yep, podiatry is a specialist, so yeah, they would be.
Chiropractors. That's important.
Yes.
Because the notion of traditional medicine having answers for everything is not the case.
Yes.
I mean, it really isn't. People are looking for help. Pain management.
Yes.
Pills are not working.
Yes. Well, when you look at these plans, their whole objective is to have many, if not all, the health systems and hospital systems, medical systems in these plans to facilitate and to give care to the members. So you start to look at the footprint of the health systems that are in Cincinnati or Dayton or Cleveland or wherever, Toledo. They're looking to expand the networks so that members can have that flexibility to come and go and not have to worry about coverage.
So is a person that is a snowbird, are they okay?
They are. Actually, there are provisions in some of the plans that allows you to go south if you want to stay there for a year. Just let the company know and they'll still have you covered for 12 months. So for those folks who do go south during the winter and come
Yeah.
north during the summer, that's an option.
Okay, so that now are there any options for expatriates, people that want to live in Spain or Chile or wherever all year? Are they kind of out here?
Well, those individuals, that's a whole nother segment, international. They can do that, but the coverages, say for example, if you were on a cruise ship, and let's take for example, the cruise ship is kind of like you're dealing with that company, that country. So in doing so, the benefits are there, but you have to look at the specific plans.
Okay, so it gets back again to making sure that your agent knows your vision
Your situation,
and your situation, that if you're going to be out and about
traveling.
like my daughter that I like to visit in Vegas, my plan will cover that.
Oh yeah, out of state.
Yeah, out of state, I can go there, and if something happens, I'm fine. But those again are questions that you have to be willing to share with your agent.
Yes.
So he really, I know he's not a doctor, but he's very, or she's very integral to your health solutions.
Yes. Yeah, they need to know your lifestyle. They
They
need
do
to know
need to know your lifestyle.
how you do you travel? Do you go see your grandkids? Do you work out? Are you fit? Do you see your doctor regularly? All these things matter because it's self-maintenance now.
Okay.
So it
So
goes.
you really literally have to not only self-maintenance, but you have to be your own advocate as well.
You do. Yeah.
That's going to be a challenge for a lot of people because they're advocating for things that they don't have a lot of information on.
They do. I mean, they are. And the question goes back to, we don't like to share a lot of that information, but they already know. So when doctors make prescriptions to you, pretty much us not wanting to take the prescriptions or whether they don't want to, we don't want to disclose those things. The powers that be that handle medical information, they already know what we're doing.
Wow. No secrets.
No, there's no secrets.
No secrets. Listen, time is wrapped up.
Okay.
It's been great.
Thank you.
Do you feel comfortable giving people your phone number?
Sure, I don't have a problem.
Okay, well, let's go for it.
Sure. You can reach me at area code 678-865-9719, and it's Dr. Curtis Weaver, 678-865-9719, Dreamweaver Financial. Thank you.
And for those of you that have been faithful for this entire interview, I'm sure that you've learned a lot as we prepare for this upcoming season of Medicare. Do take care of yourself, please. It's more than COVID. It's a variety of diseases and situations that are upon us, and it is imperative that you love yourself, self-love, love yourself, take care of yourself, attend to yourself first. You can't help anybody else if you're sick. I appreciate you being a part of this interview today and being a loyal listener of The Power of Money with your host, Michelle Graves, affectionately known as the Money Lady for over 40 years. So I know a little bit, I don't know everything, but I do know a little bit, and of course my commitment remains to help you in your decision making so that you can live through your life thriving and prospering. Take care, and I'll see you soon. Bye-bye.